everyone. Happy Saturday evening. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And this is Saturday night in stress management boot camp. We are doing a brief summary. We had a couple heavy days in a row about blood work, and last night was on thyroid lab work. So we're going to talk about wellness. We're going to talk about the things that you should be incorporating every single day, whether you are in quarantine or out of quarantine, whether you are in the now time or the after time, whatever we're going to call once they release us. We're also going to discuss the incredible week that is ahead of you. So sit back, relax, and stay tuned till the end because there's some amazing things happening. As always, if you're watching live, say hello. It's always fun when I'm not in here by myself. If you're watching the replay, let me know that as well. Give us a thumbs up if there's something that you agree with. If there's something you have to contribute, please share the information as well. And this group is for you to learn, it's for you to share, it's for you to commiserate. And I'm hoping that everyone comes out on the other side of this much better than we all went in. And if the information is beneficial, if you are enjoying it, as always, please share. I am hoping that we are able to grow together, learn from one another, and have some fun while we are all going through this. And apparently I look like, what's that, Flintstone Pebbles? Wonderful. Hi, Casey. So that's what's happening here. I have referenced this diagram. And I know that stuff gets kind of flipped around on Facebook Live. So I am going to show you guys this. So this is an amazing representation. It's called a prevention to invention hierarchy. And the purpose of this, I've talked about this before, but depending on where you are in your wellness attitude, let's put it that way, will determine how much intervention you need at any one point in order to stay well or recover from a chronic illness or recover from a chronic infection like we're all trying to stay away from right now. So let's use back health, being a chiropractor. Let's use back health as our example tonight. So lifestyle maintenance for maintaining your back health would be considered normal physical activity. Now, if you want to have some lifestyle interventions, that is considered exercise and flexibility training, which I would suggest everybody do anyway. Augmented lifestyle interventions, so what we're doing here is we're taking it one step further. This is where, again, I think everybody should be, chiropractic and some physical therapy. Hi, Kevin, thanks for tuning in. And then finally, rescue intervention. So if you're completely neglecting yourself and you're letting your back go and you're not eating well and you're stressed out and you're not engaging in those movements and healthy spinal hygiene like everybody should be, then what is your rescue intervention going to be? It's going to be surgery and pain management and medication. Okay, so is that the style that you want to grow accustomed to, or do you want to start to have those interventions a little bit earlier, the chiropractic, the physical therapy, the lifestyle modification, having proper posture, all of those things? That would be my recommendation. So let's use cancer. Okay, that's a good one. So lifestyle maintenance in order to avoid cancer should be having a wholesome, diverse diet. And we have done a ton of videos on healthy eating and eating your 9 servings of fruits and vegetables and things like that. Okay, that's what everybody should be doing. That should not be something special. That should not be going above and beyond. That's what your body was designed for, and that's how you avoid getting cancer. Okay, this isn't news. What do we need to do? What sort of lifestyle interventions, if you want to take it up a notch? You could increase your fruits and vegetables and focus on cruciferous fruits and vegetables. Okay, that's a good suggestion. Now, if you need to engage in augmented lifestyle interventions, you may want to add some supplements, again, because the quality of our food probably isn't amazing. And then finally, what is your rescue intervention? We all know what the rescue intervention is for cancer. It's drugs and surgery. So you want to be aware of where you fall in that paradigm of intervention. What does that look like to you? Are you someone that waits until the end and you're a drugs and surgery kind of person? I'm assuming since you're in this group and you're friends with me and you're enjoying what I have to offer, you're probably not in that category. Or if you were, I'm slowly pulling you into the lifestyle intervention category. That's what I hope for everyone. So I hope that you're learning that what our body needs and what our body thrives from is going to be those early interventions. It's going to be taking things one notch further. And if you're planning on having, if your normal is 2 servings of fruits and vegetables a day, I hope at this point, after we've spent, I don't even know it now, 6 weeks together, how long have you been doing this? 7 weeks since St. Patrick's Day. I'm hoping that you are incorporating these things that we're learning about. So one of my favorite people, Dr. James Chestnut, if you don't have this book, it might be available on Amazon, I don't know. Maybe I'll start another group and it'll be like Jordan's bedtime stories and I'll read this to you every evening. It's worth it, believe me. So a couple pages that I earmarked, a few things I want to go over. Let's talk about the documented benefits of walking. Okay, who can't walk? All of us. Even with what's going on right now, you're still allowed to leave your house, you're still allowed to go for a walk. So let's talk about the benefits of walking. Walking will prevent up to 91% of cases of obesity and type 2 diabetes. And if you saw my talk on all of the money that we spend daily, we spend multiple hundreds of millions of dollars on obesity and type 2 diabetes. And I will tell you that that is 100% preventable. We are all at fault for those diseases and that spending. So if you went out for a walk, you could prevent 91% of those cases. Growing up in Green Oaks, we had a woman and we called her the walking lady. Honestly, I have no idea who she was. We lived there for 30 years, but she would walk twice a day. And she was very, very fit. And we'd see her walk in the neighborhood. I should have been with her. One of the other benefits of walking: prevents up to 50% of all cases of heart disease. It reduces stroke by up to 30%. It prevents up to 50% of stroke deaths. So I've talked about this a million times, okay? So let's hit epigenetics one more time for those of you that didn't see that video. All of us have genes. And the reason this is so important and the reason I'm so passionate about this is because I've literally had patients come into my office and say, well, I have back pain because it's genetic. What? No. You have back pain because of poor habits. End of discussion. So we all have genes. So maybe I have the gene for diabetes, for cancer, for heart disease, whatever it may be, okay? Now, if I'm following my own recommendations and I am eating well and I'm exercising and I'm managing my stress, because again, we can't eliminate stress, but we can change how we adapt to it. What I'm doing is I'm pulling my sleeves down, so I'm not going to express those genes. I'm not going to express the gene for heart disease. I'm not going to have a heart attack. I'm not going to express the gene for cancer. Remember that with those lifestyle modifications, about 90% of site-specific cancers disappear. So I'm not going to express those genes, okay? Or if I do, like this just says, walking prevents 50% of stroke deaths. So what did that do there? It didn't eliminate my chance of having a stroke, but my healthy behaviors improved my opportunity for recovery. And that's what this does. We're pulling our sleeves down, so we're either not going to express those genes, or if we do end up with cancer, our chances of recovery are much higher. Now, on the flip side of that, epigenetics also means that if we are stopping at McDonald's every week and we are not exercising and we hate our job and our spouse drives us nuts, we are rolling up our sleeves and we're essentially saying, come get me. And we are expressing the gene for diabetes and we're expressing the gene for cancer. So we are diabetic and we're being diagnosed with cancer and we're having strokes. It's possible. And heart attacks, okay? So that's what epigenetics is. So that's what our healthy choices, that's the impact our healthy choices can have on our behaviors, okay? So we, with all the education that you have learned in here from me, again, 7 weeks, 7 times, so that's 50 videos. That's 50 hours of my time that I have given you all to learn. You better be implementing some healthy choices out there. What else does walking do? It normalizes blood pressure. It restores and normalizes cholesterol triglyceride levels. If you have high triglycerides and you're not walking, no excuses, none. Walking reduces the risk of breast cancer up to 60%. What are some other really specific ones I can give you? It improves digestion. Okay, so let's talk a little bit about my favorite topic in the entire world, bowel movements. Okay, I gotta get comfortable for this. There is absolutely no excuse in the entire world for anyone out here to be constipated, okay? This is the #1 thing that you can do for your health to improve how you're feeling, to decrease your incidence of cancer, is to poop, okay? Nobody wants to talk about it. Everybody's grossed out about it. I'm gonna write a book for adults, like they have all the pooping books and the potty training books for kids. I'm gonna write a book for adults called Everybody Poops. Everybody does. And it is so important. And if you are constipated, the majority of the time, there are little tweaks that you can make so that you are able to go to the bathroom. So what is a normal bowel movement? It took me about 5 years of practice of asking patients, are you normal? And everyone would say yes. And then it dawned on me that patients had no idea what normal was. And at any time, feel free to like these comments because, again, we know everybody poops. So if you're regular, give me a thumbs up, give me a heart. Normal bowel movements, you should be having 2 bowel movements a day. They should be easy. They shouldn't occur with stress and strain. You shouldn't need to be in the bathroom for like half an hour. Okay, this should be an easy event. And if you're not, and the other thing is they should be like snakes. You want snakes, you don't want rocks. You don't want rocks and you don't want water, you want snakes, and then you're good to go. Now, if you are not having 2 to 3 bowel movements a day, there are very easy modifications that you can make so that you do. #1 is increase your fiber. And what is that? Your fruit and vegetable intake. Juicing is great, smoothies are great, but that chews up a lot of the fiber or it eliminates a lot of the fiber that you should be having. So I want you eating the actual whole fruits and vegetables. Again, go back and watch my video on 9 servings of fruits and vegetables a day. It's very easy to do if you plan. The other thing that you need to be doing is drinking your water. This is 24 ounces, I think. Yeah, if I fill it to the top, it's like 24 ounces. So this is #4 for me right now. What time is it? I don't even know, 5, 7? I'm like 5, 6, 7. Okay. So I'm on like technical difficulties. Okay, so I'm on like 90 ounces. And depending on your body weight, you should be drinking half your body weight in ounces of water. So if you weigh 150, then you should be having like 75 ounces of water. If you weigh 200 pounds, you should be having 100 ounces of water. It's pretty easy to remember. Increase your water intake. What else? I'm a little distracted since I lost my stand. Fiber, water, activity. What were we just talking about? Walking. So as if you need another reason to get out of the house, go for a walk, okay? If you're not moving, you gotta move to get things to move. So go for a walk. Quick 30-minute walk. We've been doing it every night just to try and wear Parker out. Whatever excuse you need, go for a walk. So there are lots of easy things that you can do. Increase your fiber, increase your water, go for a walk. Taking my own advice here. If there's anything else that you all have found that help improving bowel movements, please feel free to comment below. If you are having digestive issues, a few things that you can add in, of course, are probiotics. The type and quantity of probiotics that you should be taking vary for everyone. So my recommendation is when searching for a probiotic, again, it should either always be refrigerated because it is a live bacteria, or it should be housed in a blister pop pack where you're popping each capsule out individually before you take it. Another thing that would be beneficial for improving your digestion is digestive enzymes. And I take these with protein-filled meals. So usually, it's going to be like a Blair Witch Project in here pretty soon. Typically, that's lunch and dinner. So it depends on what your heavier meals look like, what your protein-heavy meals are throughout the day. That's when you want to be taking your digestive enzymes. So there's lots of easy options to improve your gut health. Now, let's see if I can do this simultaneously. There's a few other quotes I wanted to share with you while we were talking this evening. So, let's see. Let's see if I can find them one-handed. Okay, are you ready? There are literally thousands of published peer-reviewed studies documenting the health and preventative benefits of consuming fruits and vegetables. Increasing fruit and vegetable intake increases sufficiency of genetically required nutrients and thus increases overall health and function. As if you needed another reason to be eating your fruits and vegetables. So the Journal of Cancer Epidemiology and Biomarkers and Prevention reported in 1996, okay, when was it? That's when I graduated high school. Yeah. In 1996, that men who eat fresh fruit every day had a 70% less chance of dying from cancer of the digestive tract than those who ate almost no fruit. Okay, how hard is that? It's not. So that's my point with all of this, is by making a few easy tweaks, you'll improve your quality of life. You'll decrease your risk of pretty much every site-specific cancer, but every chronic illness, every lifestyle illness, by making a few easy tweaks. So again, as always, this one's a little quicker because I'm doing it with my arm. My arm's falling asleep. So if there's anything else that we can answer, feel free to send me a message. If there's a topic you want to discuss, if there's a question that you want answered privately, feel free to reach out and we'll talk about it. This week is going to be amazing, and I'm going to do my best to send a schedule out because the times are going to vary greatly. So my friend Rita is going to join us tomorrow, and she is going to discuss how to incorporate Young Living essential oils to help manage stress. So we've noticed in the office that we still have a handful of clients that are uncomfortable leaving the home. They're really following the stay-at-home order to a T. Even though chiropractic care is considered medically necessary, they don't feel safe leaving the home. And I understand, to each his own, that's okay. So what can we do to help you serve yourself while at home? And one of those things that you can incorporate that is very easy to help manage stress is using essential oils. So we're going to talk about, should you be taking them internally? Should you be diffusing them, which is what I do the most of? Should you be using them topically on your skin, on your kids, things like that? She's amazing, so she's going to talk about that tomorrow. On Monday, we're going to talk with one of my longest life-standing friends, direct from Austria. So we have to do it a little bit earlier, or else, if it was this time, it's like 4 a.m. there or something. So she gave us some time constraints. So we're going to be discussing what life has looked like overseas, what she has done during quarantine, and some just healthy habit suggestions from our friend Erin. What else do we have going on next week? I think my girlfriend Shelly is going to join us. We're going to talk meditation. We're going to talk stress relief and relaxation. And then on Friday, which should have been our office anniversary, 14th anniversary white party, we are going to be talking with my good friend Nicole. So dress in white, grab a glass of bubbly. If it's me, it'll probably be kombucha. And join us for that. I think that one's also going to be around brunch time, so that might be an 11 a.m.er. So I'll do my best to get the information out ahead of time. We have some incredible people coming up in the next few weeks. I am so excited. So please stay tuned, stay invested, share this group with anyone that you know that is currently suffering from stress. Share this in your mom groups, share this in your networking groups, because we can all use some stress tips. I think that we need to recognize it's okay to not be okay. You know, I'm seeing more posts about people saying, you know, I kind of dropped the ball as a parent today, or I'm reaching the end of my rope. And you don't know who's not okay, oftentimes until it's too late. So please, and I apologize for all the jumpiness, my hands are falling asleep. And if you are just now tuning in, my phone holder fell off the table. So that's the situation that we're in right now. So again, if you find the information beneficial, please share, please comment, please post, please give me some likes so that I know that this is worth all of our time. Have a wonderful evening. I'm off to dinner, and love you all. See you tomorrow. Bye-bye.